Welcome to SpaMedica.com TV. My name is Dr. Stephen Mulholland. Good to see you again. We're going to talk about a very, very popular topic, liposuction, the contouring of unwanted fat. Little convex distensions, lumps and bumps, saddlebags, the pot, the love handles, the inner and outer thighs, the things that we don't like, that we can't get with exercise and diet. Liposuction's totally changed. Gone is that primitive sort of prehistoric technique you've seen on Nip Tuck or Extreme Makeover, where there's a large cannula that traumatically removes the fat. Over the last few years, with the emergence of SmartLipo, BodyTite, Vaser ultrasonic liposuction, we use energy, gentle energy, to liquefy the fat, tighten the skin, and then remove that liquefied fat to get good skin shrinkage and nice contours. Let's take a look.
Off the top, we're very happy today to have Dr. Steve Mulholland here, and he had a client named Dale. When Dale came to see him, she wanted her pre-baby body back. Can you relate? I can. Let's watch her transformation right now.
Hi, good morning, Dale.
Hi.
Hi, Dr. Mulholland's ready to see you.
Great.
Okay, so come on back.
Hoping that I can get back the figure that I had before I was pregnant, because I found that after the pregnancy and breastfeeding, I lost all the volume that I had in my breasts. Now they just sag. And then around the middle as well, I feel the skin's really stretched out, and I'd like to be able to tighten up the skin in there a little. But I am working out 3 to 4 times a week, running, doing the sit-ups, the weight training, but it's just not showing in my body overall. I find there's just those certain areas that I'm not getting.
On the tummy, just bend down just a bit. That loose stuff right here is where we're going to do some tightening. We're going to do some subsurfacing or subdermal laser tightening, and we're going to remove a little bit of that skin and tighten that for you. As with many young moms who've had their children, it's not so much about trying to look younger. It's just trying to recapture some of the body they used to have. You expand, contract with pregnancy, and you wake up one day, your kids are off to school, and you look in the mirror and it's like, usually what I recommend is a nice teardrop shaped cohesive gel implant. And then we do what I call a SmartLipo assisted mini tummy tuck, meaning we only use the C-section scar. We remove a little bit of skin, and we do what's called SmartLipo up on the tummy and the hips, which is using a laser to melt the fat and to tighten the skin at the same time. So we get a nice tighter tummy, very little scar, very little downtime, and a nice breast shape.
So many of us have been in that same situation. And, you know, my answer is after you have a baby, just never bend over and never sit down. And then your stomach is always totally flat.
It's a cheaper solution.
That's a cheaper solution. But your solution works very well. When we see the afters, we're going to see sort of the full effect. How often do you get women in that same situation?
It is probably the most common patient I see. A woman between 27, 28, and 45 to 50, had 1, 2, 3, or 4 children, has devoted her life to reproductive medicine, and now looks in the mirror and wonders where her body went. So it's almost like aesthetic reconstruction. It's trying to recreate or grab onto what one once had, a tight, firm tummy and body, and breasts that match your figure.
Is it ever doable? Like, are we ever really able to get back to that tight tummy without a little bit of help?
We can get very close to that 25 to 28-year-old figure you had pre-baby. We've got a lot more aesthetic solutions, a lot simpler solutions. It's been an amazing renaissance for the postpartum mom.
Now, for her, she said that she had worked out and everything, but there was always a little something, and she had had a C-section. Does it make a difference, do you think, whether it's a C-section or it's a different sort of birth, a vaginal birth? Does that make a difference in terms of the elasticity in your stomach?
I don't think it makes a difference on the condition of your tummy post-baby. Some of our incision ports or access positions are easier with C-section, but whether it's normal vaginal or C-section, the common complaints are loose skin, stretch marks, no muscle tone, and this pot, this bulge with a little bit of fat and loose skin you can't exercise away, or breasts that just deflated in front of your eyes, and so you wear an evening gown and there's always that little wrinkling and no fullness up top, or you wear an underwire push-up and there's nothing to push up, or you just want to wear a tank top with nothing on underneath and there's nothing there.
Are you kidding me? With nothing on underneath?
Absolutely.
Yeah, those days are over for me, my friend. I remember them, though. So what I found interesting about that tape is that you said you actually go through the C-section incision. So
the common points that we go in to do this SmartLipo or tummy tightening with lasers and probes, the belly button, through pubic hair, through C-section scars, so very unobtrusive. Certainly more so than it used to be with the big tummy tuck scars.
Right.
The breast implants, we're going to talk about that later, but there's many stealth ways to go in and bring back that volume.
Excellent. Well, you did a really, really good job. So Dale, as we mentioned, wanted to restore her body to her pre-baby look. Let's take a look at the results.
Dale, it's so good to see you. You too. How are you? I was just looking at your pictures and admiring your post-op outcome. Come on in. Let's have a look at them. So Dale, it's 8 weeks after your surgery. What do you think?
I love it. I think it's great. I couldn't be happier. And yeah, I'm no complaints at all.
If you look at the pre's, you can see it was difficult for you to fill a bathing suit.
Definitely,
and we've got a nice little post picture here. It looks like a natural breast.
Yeah.
It doesn't look
definitely.
fake.
I feel great right now. Honestly, though, I think for the first couple weeks before surgery, I was on an emotional roller coaster. Of course, I was usually excited and couldn't wait to have the surgery done. But there's also a lot of times when I was feeling really anxious, very nervous, and almost getting cold feet at some points, mainly because I'd never had surgery before, and I didn't know what to expect. I was worried about what the results were going to look like, but also worried about the recovery, worried about any possible complications. But now, 2 months later, I am so glad I had the surgery done. This body makeover was probably one of the best things I could have done for myself. I love the results. I think that Dr. Mulholland exceeded my expectations. I had hoped to regain back the fullness that I had before pregnancy, and I think my body's even better than it was before I was pregnant. I love it. I had my 40th birthday this summer, and I think I look better than I did in my 20s.
Now that's good work. She feels better than she did before the baby. That's amazing. So you've got some befores and afters here.
Yeah, I think this really highlights and will resonate with any woman that's had children. You know, that bent over and it's kind of a little loose.
Yeah.
That's very easy to fix now. So, under local anesthetic, that's the other thing. You don't need a general. You don't need to stay overnight. It's very quick, relatively painless. This little post-mummy tummy, usually below the belly button or the little wrinkles above, and when you bend over, it's loose. It's just not as sexy as it once was. So as you said, you never bend over and you never sit down.
Like I am right now.
This is her bent over view after. You see it's nice and tight, more pre-babyish. And you know, I think having children is great. Sometimes it ravages the body, and we should take pride in being moms and dads. But you don't have to live with the consequences of childbirth anymore if you don't want to.
Well, the other thing is you're going through so much hormonally as well. It's really tough to get used to your new body. So it's nice if there is something that can help you sort of get back to the way you were, the way you liked your body. How long did she wait? After she gave birth?
Yeah, she was about 4 or 5 years after. I mean, she worked out and dieted, hoping, as many women do, I can do this. I can exercise through my loose skin, stretch marks, and that little roll. And so I never advocate doing any kind of procedure within a year of breastfeeding. Not just childbirth, but finish the breastfeeding, because that estrogen progesterone has an effect on your skin. Right. So that all the dust settle, that everything just deflate, droop, and sag. Try your best in the gym, and some people do. They have surprising genetic code, and their skin looks great after children, but some don't. And so wait a year, see a cosmetic plastic surgeon you feel comfortable with, who offers you minimal invasive and options in restoration. So 1 year.
How long for recovery for her? Or in general?
You're up and walking that day nowadays. You're up and moving that day. Nothing heavy lifting for 3 weeks, but you're back to your normal lifestyle within a month.
All right, you have brought down a fantastic gift for everyone in the audience. I think you're really going to like this. Dr. Mulholland has brought down a $100 coupon and some SpaMedica skincare products for everyone in the audience. So if you wanted to, you could go and get one of the non-invasive procedures, put this towards anything you want. Thank you so much. That was a really good lesson.
What a great way to change your figure, shape, and form to capture what you really want to capture. We have gentle, minimally invasive ways to shrink your fat and tighten your skin. Ultrasound, SmartLipo, BodyTite. SpaMedica.com, check it out, look for the procedures, review it, see the before and afters, or come in and see me. I look forward to helping you get that figure, shape, and form you've been looking for.